Oh yeah, now we getting back to basics right here because we're going to take a look at knee pain and different things that you can do to strengthen your knees. Not exactly the knee structure itself, okay? Just as a personal trainer myself, that's one of the most common complaints that I get out there. Okay, I need to exercise more because my knees hurt, or I can't exercise so much because my knees hurt. And you know what ends up happening at the end of the day? You exercise because your knees hurt. You know what you need to do? You need to strengthen and then also stretch out different muscles, okay? And I'm sure our good friend right here, I think Wuku Pin, it's not I'm not being a bigotism or anything like that, okay? That's not derogatory. That's just who's going to be guiding us through all this stuff. Knee pain is something anyone can encounter. The go-to relief methods tend to be anti-inflammatory medication and painkillers, but no, don't do that. That is stupid. The pain may persist, worsen, or in severe cases, make it so that even walking becomes difficult. Well, you could also be fat and you need to exercise in order to lose weight so that there's not so much pain on your joints, okay? They're ankles and knees. They're not supposed to be trailer jacks. Judging from clinical observations, knee pain tends to occur from in ages of 4 steps, 0 to 20-year-olds, in the susceptible stage, 20 to 40, preclinical, 40 to 60, the clinical, and 60 to 80, the disability stage. That is to say, knee pain is prone to occur after the age of 40. I had my worst knee pain, but of course this is just this is an exception. It's not here to disprove the rule or anything like that. Back when I was in organized sports, playing football at the time, got the old chop block tackle, and really put an end to my football playing career. We'll just say that. But since then, ever since I started, training a lot more vigorously, consistently, touch wood, man, everything's been pretty decent, all things considered. So the most common areas of knee pain, all right, are the medial plica inside the knee joint. Frictional phenomenon inside the knee joint will cause physical damage. Chondrocyte interstitial damage, as in between. Interstitial means in between. It's a very fancy way of saying that. Or chemical corrosion caused by joint synovitis, and the cartilage fragments produced by the joint will cause friction, resulting in severe pain. Outside of that, sometimes it's just ligament damage as well. Like let's keep it a buck. Anatomically, the medial plica of the knee joint is the joint capsule, which is a soft tissue. Under repeated friction and clamping, which can be up to 1 million times a year, it will become inflamed and swollen. The chemical enzymes released in this inflamed tissue will corrode the cartilage, which causes the knee joint to degenerate, and the more destructive than physical damage. Yeah, of course, because then it's your body attacking your body. Don't have that happen. Most common cause of knee pain is a leg length discrepancy, LLD. Interesting. Okay, incidences of LLD about 40 to 70%. Okay. LLD can be further divided into structural LLD and functional LLD. I'm not saying that over and over again. You guys need to stop. So structural refers to the actual difference in the bone length between the 2 feet. Functional refers to the changes in the biomechanical system in the lower limbs due to external factors. It's kind of like one of those things, okay? I don't remember where I heard this before, but you might have heard it as well. Like when you're sitting down, especially if you're a guy, you have your wallet, okay? Don't sit down with your wallet in your back pocket because it's going to end up, messing up the lengths of your legs. That's kind of what they're talking about right here. Diagnosed functional means a difference between the 2 feet is more than 2 centimeters, at which time it should be actively treated. Yeah, that sounds interesting. In addition to causing knee pain, LLD can also easily cause ankle and hip pain, pelvic pain, scoliosis, back pain, cervical pain, and even headache. I don't know why headache needed the exclamation point, but that's cool. So, all right, running this stuff down. So, skeletal development in the lower extremities is uneven or fractured. Here are the causes. The main cause of structural. The easiest way to deal is to wear corrective insoles and reduce the difference in the length between the legs, and then eventually it'll manage itself out. Okay, pelvic dislocation is the second one. Includes anterior or posterior rotation. Sometimes some ligaments and some muscles are either too tight or too weak, and that your pelvis, your pelvic bone itself, okay, it either it'll tilt forward so that you just have a natural, like you stick your butt out, okay, that's normally that type of walk, okay, kind of like a duck walk. If you've ever seen anybody just kind of walk with a little bit of a slung back, okay, and their butt sticking out, and they are pushing a cart or something like that, and it's like, are you trying to do some sort of a borked mating call, or are you just stuck like that? That is anterior pelvic tilt, okay? That means that it's rolled forward in an anatomic fashion. That's what that infers to right there. Now, I could break it down as to what muscles are causing that to happen, but long and short of it is you don't have a strong butt and that your hip flexors are just a little bit too tight. Work on that stuff, you can figure it out from there. Posterior pelvic tilt is the guys that would obviously kind of have the inverse of that, okay? Just have weak abdominal muscles. They're just constantly kind of pointing their junk forward. You normally see that with an old guy just shuffling around like that. That's normally caused by sitting too much, okay? You correct that type of stuff, and you can figure it out from there. That is a 30,000-foot view of all that stuff, but, you know, just to show that I'm not a quack or a fraud. Pretty much covered that. We could get into the weeds on this. It's been a minute since I've talked specifically in the technical terms, so indulge me, folks. Pelvic dislocation includes anterior and posterior rotation, internal and external rotation of the ilium and on both sides, dislocation of the your hip joint, and excessive curative of the sacral vertebrae. In real life, more than 90% of people's pelvises is slightly inclined, mainly because most people habitually do movements leaning to one side. Small number of people may suffer trauma and dislocate their pelvis. Yeah, that's always referred to as one of the most difficult things to do, but then also, if it happens to you, one of the most traumatic injuries you can acquire. Transposition of the hip joint, if it becomes dislocated. One side lower extremity joint pain. Let's dive into this one for a second. Due to the pain in the ankle, knee, hip joints, and the affected side, the weight of the body will be concentrated on the healthy side when walking, which can easily cause a joint injury on the healthy side, pelvis skew, and scoliosis, resulting in functional LLD. Poor posture, poor exercise posture, or habitual unilateral movements. So constantly moving in one direction, you know, you're jogging, either you're all hunched up, you're moving around like this. Okay, if you're lifting, I could do a bunch of different examples of poor lifting posture. Basically, okay, if you're performing your motions outside of your center of mass, you're going to have some problems because you're putting undue stress on different points of your body that aren't designed to handle that type of load. And then, yes, poor posture in general. Always just do a posture check. Make sure that your ears, your shoulders, sorry, it's been a minute. Ears, your shoulders, your hips, your knees, and your ankles are all aligned, and that you properly have a nice length in your neck, ladies. Tightness or weakness in lower extremity muscles and ligaments, some of which I touched on when there was an anterior or a posterior tilt to your pelvic bone. More often than not, unless you're an Instagram thought that are out there, might have weak butt muscles. More than likely, okay, if you're an office worker, you're going to have tight hip joints. Same with truck drivers, same with anybody who sits for an inordinate amount of time. Your body normally just wants to return to a homeostatic state. What does that mean? A comfortable state. So if you're constantly contracting your hip flexors, they're just naturally going to just want to stay shorter, which leads to a bunch of structural changes like posterior or anterioring, moving your pelvis forward, because those muscles are tight. And outside of moving around every once in a while, you're not really using your good old glutes all that often. So they're weak. Your hip flexors are tight. What do you do about that? You correct both in order to treat that. So now we got exercises. Okay, now here's what I'm telling you. Wherever you have pain, chances are that's actually not the cause of the pain. That site in particular isn't the cause of the pain, especially when it comes to structural issues inside your body. If you have an ankle problem, chances are it's something up a little bit higher that's actually causing you that pain to begin with. It might manifest there, but it's caused by something somewhere further up on the chain, okay? You got knee pain? Well, guess what? There's a multitude of different things that's causing it. Chances are it's something above and of below. Mentioned that at the outset, but now we're getting into the finer details. So here are 6 exercises to keep your knees healthy. Train the strength of your quadricep muscles. Yes, of course, if they're too weak, and your hamstrings, because again, just think about it. Okay, your quadricep muscles are responsible for knee extension. What do I mean by that? Fully closing the knee joint, okay? Like, they also attach above the hip, but we're talking specifically about the knee, okay? 2 of the heads of the quadricep, don't have to question me on that one, attach below the knee, okay? Responsible for contracting the knee, or extending the knee. Your hamstrings are responsible for contracting your knee, but for knee extension, for lengthening out your leg via the knee, those muscles aren't strong. Chances are your hip flexors are going to, or not your hip flexors, sorry, we've been talking so much about those. Your hamstrings are going to try to overcompensate. So your knee is designed to have the most stress on the front of it, but if there's stronger muscles on the backside, ooh, that structure, not really going to like it all that much. So strengthen your quadriceps. Sit with one foot straight with the toes pointed upward, tensing the muscles of the thigh. Yeah, isometric contractions. You can feel it too, okay? You flex your quad muscles, you can feel a move. There's 4 of them that are in there. See how many you can find. After holding for 10 seconds, lower your calf slowly. Retract so that you have the 90-degree bend in there as well. Then work the other foot, or, hey, if you're getting a little stronger after a while, grip onto the side of the bench and move both of your legs up at the same time. Or you can go to that funny looking chair that's down there at every single gym that nobody wants to use because everybody skips leg day because they're stupid. Knee tuck exercise. All right. Sit holding the distal end of the calf near the ankle with both hands. Let the calf adduct as much as possible to the hip. The knee joint to a maximum angle. Hold for 30 seconds. After that, strengthen the leg and gently allow the leg to bend and stretch 5 times. That's just adding a little bit of load, because as you can see, I just moved it ahead a little bit. Okay, so yeah, holding onto your shin, just never on the joints themselves, because the tendons that are in there aren't designed for direct pressure on top of them. So even if that is, like grabbing onto your ankle, you can grab onto the top side of your foot or right onto your shin, wherever your arm length dictates, or your flexibility dictates as well. And that, yeah, you just try to break the grasp of your hands if you're sitting down like that, or if you're standing up as well. I guess you could accomplish the exact same thing. It does the same when it comes to strengthening your quadriceps. Knee compression exercise, sitting in a chair, one leg strengthened. Yeah, this is just different places where you can put your legs. It's basically trying to activate the different heads of the quadriceps. So you put your leg up on a table as well, and that you just try to press your knee towards the ground. It sounds painful, but it's all right. It's a different type of contraction that's being applied there. You will not be strong enough to snap your knee backwards, okay? That is not going to happen. That's just a different type of compression, okay? Might feel good. Might end up snapping some things out. Lying on stretching bench. Oh, okay, yeah, that makes sense. You can do that on the ground against the wall or anything like that. It's just basically trying to stretch out your hamstrings. You can do the exact same thing. Feet, just sitting down on the ground, legs either akimbo or straight out in front of you. Lean forward as much as possible. You'll feel it right in the back of your thighs as well. Never bend your knees, though. That's the one place you don't bend your knees. You bend at the hips. That's it. Keep looking straight forward. Keep moving your hands either right along your thighs, across your knees, towards your feet or your ankles. Hell, try to grab your toes. Try to grab your soles. Try to grab your heels. Whatever you can get away with. Hold for 10 to 15 seconds. Repeat as many times as you like. 5, 10 times. Just do it. Do it once, do it often. Always stretch out your hamstrings. So they are constantly being contracted, especially if you're sitting. Stand on a stretching board and raise both hands towards the sky. Oh, okay, yeah. Maintain good posture. And just stretch towards the sky. That's more or less just trying to strengthen and correct your upper body posture so that you're not putting additional pressure, especially by leaning forward, locking your knees, and then putting undue pressure on those. That makes sense right there. And then what do we got? Number 6, massage around the patella and medial pilica. Yeah, of course, not on the joint itself. Like I said, not on the joint. They aren't designed for that. Even your kneecap, okay? It's just kind of floating right there anyways. Okay, it's kind of indented in your ACL. Regardless, yeah. Above and below, the origin points and the insertion points of the different muscles that are inside your leg. If you notice any sort of inflammation, any additional heat that's there on either side of it, you can ice it as well. But of course, the links to these articles, if you want to watch the videos in and of themselves, if you don't like my description, fine, that's fine. You can just watch this Chinese guy. You can break it down for you. But activities to avoid, let's see, sudden bending or prolonged 90-degree knee bending. Stop sitting so much. Riding a bicycle, bending and straightening. Yeah, if you have knee problems, unless it's that straightforward pedal, the recumbent bike. It's called a recumbent bike. You sit down, you pedal that way. Make sure that you have proper positioning if you have an upright stationary bike. Those are kind of hard on the knees if you can't size them correctly. So if you have somebody advising you on how to do that, that would be fine. Repeated squatting and kneeling, obviously it's going to be a repeated use issue. That makes sense. Going up and down the stairs, climbing mountains. Yeah, if your knees hurt, don't go on a mountain expedition. Seems kind of straightforward, I guess. Appropriate activities when sitting down, standing up. Hold your knees with both palms and slowly sit and stand up. Yeah, okay. Relieves pressure on the knee joint, and be sure sitting and standing postures are correct to reduce the occurrence of LLD. Yeah, of course. One of the things that I've learned, okay, over time, if you have an opportunity to, especially if you're sitting on the ground or sitting on the chair, just pull or push yourself up just a little bit. You don't have to, take your butt completely off the ground or something like that. Just enough so that you can raise your pelvis just off the ground just a little bit so that you can readjust yourself and then sit appropriately with nothing but the seat and your ass, and that's about it. Nothing in between. But I know some of you degenerates out there are obviously going to put something in between, but that's between you and God. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.